The VA has emerged as a world leader in telemedicine, improving patients' access to care. And access is the key.
Telehealth is improving care to veterans by increasing the number of times that veterans come to a doctor.
In this video, you'll meet 3 practitioners and see how they're using telehealth to improve patient care. In Puerto Rico, telehealth allows doctors to provide specialty care. In New York, it provides a forum for mental health counseling. And in Colorado, telehealth is bringing primary care to remote mountain areas.
I think it has helped the patient because it makes our system more accessible to them, and that's the bottom line.
In each case, telehealth is providing greater access to medical care while improving outcomes and quality of life for our nation's veterans. For over 50 years, Korean War veteran Tom Baumgartner has lived, worked, and played in sunny Mayaguez, Puerto Rico. But until recently, his chronic respiratory condition meant regular trips across the island to the VA hospital in San Juan.
Okay, going to San Juan is no picnic. Not only is there a tremendous amount of traffic, on the highway, but when you arrive at the clinic, there's no place to park. And believe me, it's an all-day ordeal. It's no fun at all.
But now, thanks to telehealth, Tom is never late for work or at tea time. He's traded an all-day ordeal for a 15-minute drive to his local VA clinic in Mayaguez, where he's examined by pulmonary specialist Dr. Jesus Casal.
Hi Thomas, how are you? It's nice to see you again.
I'm just fine, thank you, doctor.
I think we do telemedicine different here in Puerto Rico. The care coordination model, it's run by a nurse who assists me when I'm seeing the pulmonary patients.
Gabriel, can you help me? Yes.
Well, I can do almost as much as I can do in person. I can actually listen to their chest and listen to their heart, listen to their lungs. I have an ENT set which allows me to look behind their throat or look at their ears. I think the telemedicine has been very good for the whole system, not only for the hospital, for the provider, that in this case is me, but more importantly for the patient.
Let me ask you a couple of other questions. Are you sleeping okay?
Thomas is a very active man. He owns a laundry in Mayaguez, a very busy laundry, by the way. So he needs to stay close to his house in order to keep his lifestyle. So I think in that type of patient, we do help a lot.
In 20 minutes, I'm out of there and back across the street to my office, and it's just another glorious, beautiful day in Puerto Rico. I think any VA facility which has primary care definitely needs this service.
It was nice seeing you again, Thomas. Take care of yourself.
Hasta luego.
It helps the patient, it helps the hospital, and it helps me because it allows me to be more efficient and more effective.
It is fantastic. Definitely would recommend it for any veteran.
Here at the VA Medical Center in Cleveland, Ohio, clinical psychologist Christine Frick is helping veterans adjust to life with spinal cord injuries.
The whole recovery from a spinal cord injury, mentally, it's a process to work with them for more acceptance of where they are right now so that they can be accepting of their body and be able to enjoy life no matter what might come in the future.
Bruce Poole served in Iraq as a member of the Army National Guard and was a patient of Christine's in Cleveland. When he and his wife Mary returned to Buffalo, they found it difficult to adjust to Bruce's new life in a wheelchair.
When I came home from Cleveland, I continued to do some rehab at the Buffalo VA. I had started to see a therapist there, but I really wasn't all that happy with it. So Dr. Frick suggested doing a teleconference, a video teleconference.
Using telemental health, it's a wonderful avenue to be able to facilitate continued growth with somebody that I've already established a relationship with.
Well, I'm glad to see you again today. How are you doing this week?
It's like having them in the room with me. I can see what they're doing, I can see their posture, their hand movements, their facial expressions, and I'm able to interpret the things that you can't get just on the phone.
She was invaluable to me and to Bruce because she would listen, she would observe, she would give us everything that we needed to expect from this injury. We had a bond with her. She made it so much easier.
It's really been, I think, for both of us, a life-changing event. It's just so much easier to talk to somebody you know.
When he came back from Iraq, he was pretty introverted. Didn't really want.
If we were to travel to Cleveland for each one of these sessions, it would be 4 hours each way every other week.
It's an ideal way of connecting with people, and that's, in my opinion, what life is all about, is connection.
If I didn't have this opportunity to do the teleconference with Dr. Frick, I may not have continued with the counseling at all. This really was a saving thing for me, to keep me in the therapy.
All right, we will see you then. Have a great week, okay?
Bye.
Bye, Chris. Thank you.
Veteran Bill Jacobs is enjoying retirement on his ranch in Craig, Colorado.
We're very fortunate here. We live in a rural area. We have the wildlife all the way around us. It's a beautiful setting. We love it. It's our lifestyle.
But the closest VA hospital is more than 150 miles away, and getting there over mountain roads can be a real challenge.
It's about a 3.5 to 4.5 hour drive to Grand Junction. In the past, we missed a lot of our appointments. We couldn't make it down because of the storms.
But now, telehealth is helping vets like Bill get the care they need closer to home.
My name is Bart Taylor. I'm a PA with the VA Medical Center in Grand Junction. One of our patients is Bill Jacobs. Used to not really receive much care at all until the Craig Telehealth did open. Hello, sir. How are you doing today?
Doing fine, sir. How are you?
Excellent. Doing good. Physical exams rely heavily on nursing at the remote site. The tools I have are a stethoscope, which is done over the web. Also, there are fiber optic otoscopes, and there's a high-definition movable camera which can be moved around to inspect skin lesions.
Being examined on a television screen is a little bit different than sitting in the office with that doctor. But on the other hand, he still is able to talk to you, to look at what your problems are, and you also are looking the other way at the doctor.
I was surprised that you could provide this much level of care, and I think the veterans are actually more satisfied with their care through telehealth.
Yeah, our primary health care has definitely improved since the clinic came in, and the people that are in there are well-qualified people. They do a fantastic job. It's just an improvement for all of us veterans.
The VA cannot continue to build large medical centers in every city. The answer to that is probably telehealth, in that we can have a small clinic, a nurse or two, a computer link which would link to any doc or PA in America. This works very efficiently and very cost effectively.
But it's just made our life so much easier out here. And it's utilized by veterans out of Utah, out of Wyoming, and of course from this corner of Colorado here. I'm able to live here and actually drive 15 minutes and be into the health clinic to get the help that I need. So it's a godsend for us. You couldn't ask for any more. I have the better of two worlds.
Telehealth is reaching out to our nation's veterans in new ways, extending access to quality health care, keeping veterans closer to home, and improving the quality of their lives.
Because of telehealth, I feel like I can establish a closer relationship with our veterans. It's a much more intimate experience.
It allows you to take care of a happier patient. And every time the patient is happy, the physician is happy.
And I think we're going to be using it more in the future. I really hope so, because I think it's wonderful.